Hi, I'm Dr. Jeffrey Riopel from the Rejuvenation Cosmetic Surgery and Laser Center in San Ramon, California. And I'd like to talk to you a little bit about non-facial stem cell rejuvenation of the skin. So this process is something that we're going to talk about for using in off-face purposes. Many times we develop aging of the neck, of the chest, the décolleté, and the back of the hands or the arms. Actually, many parts of the body that are both exposed to the sun and age with time. And we've had fairly limited options in the past. The skin is thinner, it's different than on the face, it's not nearly as forgiving as the facial skin, and so as a result, our ability to improve it has been somewhat limited. Fractional CO2 has been used for a long time, but it's again somewhat limited because it can only go so deep. You can't turn the settings way up like you can on the face to get a really great result. The same thing with the Fraxel technology. You have to be very careful with the settings, using lower settings than on the face in order not to get scarring. So, as I say, there have been limitations, but we now have a great new approach. And this new approach combines the success of the Fraxel for off-face with a new technology called stem cell rejuvenation. Turns out that fat, our own fat, has millions of stem cells per cubic millimeter, and these stem cells are what are called multipotent. They can turn into or promote repair and maintain other areas than the areas that they're found. We don't have very many stem cells in the skin itself, but our fat has millions of these, so if we can take the stem cells from the fat and put them into the skin, we can actually promote repair and maintenance of the skin, and as a result slow down the aging process and promote a more youthful looking facial skin. So how do we do this? Well, it's all done under local anesthetic. There are no pain medications necessary, there are no relaxants even. It's not under general anesthesia, so one comes into the office. We prep an area where you don't want fat. Most of us have at least one area where we'd like to have less. For many people it's on the abdomen, the sides, the hips, the inner thigh, outer thigh. Some people it's the arms. Anyway, we prep that area and then we numb it using the tumescent technique. And then we use a machine called the Tickle Lipo, which is a very rapidly vibrating cannula to remove a little bit of fat from the area. And we only need about 100 cc's, it's actually a very small volume. So we take the fat out and then we put the fat under sterile technique through a process to remove the stem cells from the fat. Once we have the stem cells, we then draw some blood from the patient, and we take the blood and we process out using a special kit, the PRP, which is platelet-rich plasma. What that is a combination of platelets and growth factors. We then mix the stem cells, which come as kind of a solid plug. We mix that with the PRP to create a serum. And now we have our serum that we're ready for use on the skin. The next step is to perform a Fraxel Dual treatment. Fraxel Dual is a technology that came out in 2012. This is the Fraxel head off the Fraxel laser, and this is basically a roller, and through a very simple process using the laser we can put thousands and thousands of tiny holes into the skin of the area that we're treating. So say for example we're treating the back of the hand. We would simply take the laser attached to this, of course, and we'd roll it back and forth over the area to create thousands of tiny holes. We actually do 8 passes on the skin, and it creates holes, little tiny holes you can't see, microscopic, but entries into the skin everywhere. So now we actually have an opening into the skin. Then we simply take our stem cell mixture and we apply it with a sterile glove onto the skin, sort of painting it onto the skin, and allow it to soak in for about 15 minutes, and that's it, we're done. What that does is it's created the rejuvenation that one gets from the Fraxel device, and at the same time put the stem cells and PRP into the skin to help to promote rejuvenation of the skin, because as I say, the stem cells are responsible for repair of the tissue that they're placed into. So when they help repair the tissue, it means younger looking, better looking, in other repaired, more youthful looking skin. So that's how the process works, and we've had excellent results in patients doing this process. Again, it's all done under local. It's not very time consuming to do, so it's a quick visit to the office, and a very exciting technique. So we'd be happy to speak more to you if you'd like to give us our office call at 925-275-9333 to set up a consultation, or visit us on our website at www.reapelcosmetic.com. And thank you very much for listening today.